Welcome back to Breakfast Daily on City TV. And yes, we know that every October is Pink October. And pink in the month of October stands for breast cancer awareness. Throughout the whole month of October, all over the world, people are raising awareness about this incurable disease that claims so many lives each and every year. There is no cure for breast cancer, but with the awareness that we're creating, hopefully we can help to prevent people from getting it. And eventually, one day, we can celebrate a cure that could be discovered. Well, I'm here with Dr. Kelvin Owusu, who is our resident medical expert here on Breakfast Daily. He's with Optima Care Diagnostics, and he's going to talk us through breast cancer, exactly what it is, what the treatment options are, what the symptoms are, and why we should all be aware of the latest developments in the fight against this deadly disease. Good morning, Doc.
Good morning, Kokwe.
Good to see you.
Good to be here.
I know, it's my first time with you. You know, usually the men sit and talk,
yes.
But because I have breasts, I'm talking to you today. Okay.
Well, I also have breast, you know.
Yours is chest, mine is breast. Yours is chest, mine is breast. But no, it's good to see you. Yeah, so I've got my pink ribbon on, you know, the symbol for Breast Cancer Awareness Month. So let's just do a breast cancer 101 for our viewers. What is breast cancer?
Well, so let's do what is cancer.
Okay.
Basically, the cells in your body are constantly undergoing change, dying and being replaced. You see it more obviously in your hair. Sometimes you wake up, you notice hair on your pillow, or as you comb your hair falls out. You see your skin peeling. You know, that's normal. Okay. And as the old cells die off, new cells replace them. Now, when this system of dying and being replaced goes haywire, where cells are no longer dying anymore, but then new cells are still being produced to sort of replace the cells which were supposed to have died but are not dying. Basically, the growth of these cells are no longer responding to the controls of the brain. Then we say you have cancer. So then this cell sort of becomes a mass, which we call a tumor. Right. Now, what makes cancer unique is that as the tumor grows, it gets to a point where it begins to break off and then implant elsewhere. So then we say the cancer has begun to spread. So when this this dysfunction occurs in the breast, then we say you have breast cancer.
Got it.
Exactly. Now, there are different cell lines in the breast. So that's where you have the different kinds of breast cancer. So I mean, the breast cancer is not one disease that is called breast cancer.
This is good information, because you know, we generalize, we've got a whole month for one thing, but there are different types.
Yes, there are different types. I mean, point is, if we are well educated about breast cancer, whether it be general or specific, it's good, because once you notice an abnormality in your breast, you want to do something about it. Okay. You know, for you, knowing the specific type of cancer may not necessarily be important. You know, but I'm just bringing that to show that there are different cells in the body, and all these cells can become cancerous. Okay. So there are different cells. I mean, just to the layman, you have cells that produce milk. Yes. You have cells that actually carry the milk. You know, so all these different cells can actually be the origin of the cancer, you know, and it has some nitty-gritty when it comes to the treatment. So depending on what specific type of breast cancer you have, the treatment might be a bit different. You know, so yes, to an extent, there are different kinds of breast cancer. Okay.
Now, it used to be that we would hear about breast cancer in women, let's even say 40 and above, 50 something, for women who are maybe perimenopausal or postmenopausal. Now we're hearing of, I mean, I heard the other day of a girl, 18 years old, who has stage 4 breast cancer. And I thought, how does an 18-year-old get breast cancer? What is happening? Is it that something environmentally is happening or genetically is happening for more younger people to be getting it? Or is it just that it has been that way, but now we're getting it reported more, so we're detecting it earlier in people?
It's a little bit of everything. So it has always been the case that cancer in general is an age-related thing. So as you grow older, your probability of developing cancer also goes higher. You know, but we are hearing a lot more of younger people developing cancer. That's on one aspect is because we are more educated and more aware of it. So we are becoming more aware of the fact that somebody is developing problems with their breast. You know, on the other hand, the environment is also playing a major role. You know, and typically in our setting in Africa or in Ghana, before now, a lot of our food, a lot of our habits were more of we're doing more active work, so we're working more, you know, we're doing more physical activity, farming, fishing, whatever, and then we're eating more, we're eating less processed food. You know, more organic food. Now we are eating a lot more processed foods, and we are more sedentary, and all of these things come together is increasing the incidence of cancers in general, including breast cancer. And then also we are indulging more in recreational habits such as smoking. So we have a lot more women smoking, a lot more women indulging in alcohol, and all these are things that also predispose us to cancer.
Wow.
And then this is controversial, but I have to say it anyway.
All right.
Technically, we are giving birth to fewer children.
Yes.
Yes, and that is an issue when it comes to breast cancer.
How so?
I must stress on this one.
Okay, how so?
You see, so breast cancer, there's a heavy linkage, or let me again take it back a bit. You notice that during your cycle, your menstrual cycle, at some point, you notice how your breasts become heavier, become a bit tender.
Yes.
This is because of the hormones acting on the female body in general, because it's preparing the body for pregnancy. Then the pregnancy does not happen, so all the preparation sort of involutes, it goes back to normal. Now, so the breast is heavily hormone dependent. Now, these hormones are also linked to breast cancer. So the more uninhibited hormone activity on the breast, the more likely you are to develop cancer.
Got it.
Pregnancy is a situation or a physiological abnormality. So when you are pregnant, there's a break in the hormones action on your breast. So the number of times you cause that break, you give the breast some rest, that reduces your risk of developing breast cancer.
It actually
which then means that a woman who has never given birth or never had a successful pregnancy is at a higher risk of developing breast cancer.
Wow.
Than a woman who has had multiple births.
Yes.
Now, this might be a plus for those who are, have big families. However, the more children you have, the higher your risk of developing cervical cancer. So you have to sort of
you for balance the tin.
Exactly.
But how you balance out? So
yeah, you have to balance the whole thing.
Little or few to no children, higher risk of breast cancer, but many children, higher risk of cervical cancer.
Yes. And in relation to that, a woman who also breastfeeds her children, again reduces the chance of developing breast cancer. So that's another plus or another feather in the cap of exclusive breastfeeding, because the longer you breastfeed, the longer you delay the hormones return to function.
Right.
So that's something that we need to do. So on one hand, we are hearing about it more in younger people because of awareness. On the other hand, it's actually a reality because of our environment. But let me also chip this in that you mentioned genetics, and genetics actually plays a major role, which is why we say that if there's a family member who has had breast cancer, your chance of developing breast cancer is high. In fact, there's now we have evidence that there's a gene. I'm sure you heard about, is it Angelina Jolie, who had a double mastectomy, and because they did the test and she realized that she had that gene. So
her mother died of that.
Exactly.
So
she went to do the testing. Thankfully, she's in an environment where you can actually do the test.
Yes, so
it's still expensive over there, but at least you can do it. You can do it here, but it's not as easily accessible or available. And it's also very, very expensive. But there's a gene that if you have it, your chance of developing breast cancer and other cancers is significantly higher than the general population. So there is a genetic composition, and that person who is 18 and had the stage 3 most likely has that genetic predisposition. But because we are unable to check at the moment, that's why nobody picked it up early enough.
Let's talk about symptoms and detection and all of that. Now, for the person in question, the 18-year-old, they saw something early on, but they delayed in getting the appropriate treatment. So it was, let's take it to a prayer camp. And then when it got to the 4th stage, which was the deadly stage, then they decided to seek medical intervention, which, of course, is almost too late. But how do you even detect or know if there are symptoms of breast cancer? So
this scenario you're painting is actually a typical story from a lot of breast cancer patients out there. They did notice something. I mean, it's quite difficult to convince me that you didn't notice any change in your breast, because the breast is so obvious. It's like it's sitting right in front of you. So when there are changes,
sometimes you're in your routine. You unless something maybe is really visible or stands out prominently, it may not occur to you immediately that something looks a bit different.
When you speak to them, they will confirm that they did notice something, but then they didn't know what it was, so they decided to observe it. You see, so that's why education is very, very important, because once you notice anything that is unusual or anything that is new, you need to pay attention to it and report to hospital if you are not too sure. Even if you are sure what's going on, let somebody else also have a look at it. Somebody more objective have a look at it so that you know what's going on. You see, because the thing about cancer is that if you wait for symptoms, it's probably too late to intervene. So symptoms are actually the last. We don't want to see symptoms at all. We want to catch and the whole point of screening is to pick the thing up before it announces its presence. We don't want cancer to announce its presence before we know it's there. We want to pick it before it even announces that I'm there. So that's why all the cancer screenings are done before symptoms, because by the time you notice symptoms, chances are it has already spread. So we don't want symptoms.
Okay.
However, some of the symptoms of breast cancer would be a lump. That's the typical thing that everybody looks for.
So you feel something that feels like a lump in your breast?
Yes, if you feel something hard, something out of the ordinary in your breast. If you notice anything like that, you have to take it seriously and report for somebody to assess it. So a lump is it's a clear sign that something is going on. But let me be quick to add that a lump does not necessarily mean that it's cancer.
Right.
You see, because again, some people too, when they notice a lump, then it's like, let me just forget everything. I'm dead already. So they don't even bother going to hospital at all. I mean, I have met a couple of women like that. It's like I saw the lump and now it's like it's cancer. So let me just make my peace with my God.
But there could be help at that stage.
It may not even be cancer.
Right.
You see, but once it's a lump, let's go have a look at it and see what it is. So lump is a very important thing to look out for. Okay. Then you might have a discharge from your nipple. I mean, you are not pregnant, you are not lactating, so any discharge from your nipple, it's especially if it's bloody or it's brownish or has an offensive smell, you want to have a look, have somebody examine it and see what's going on. Now, and then you might also have some discoloration. If you have not had any trauma, nobody has punched you, or you have not fallen down and you notice discoloration on your breast, you need to take it seriously. Or if you notice thickening of the skin around the breast, any part of the breast, you want to have it examined as well. Okay. If you also notice that a dimple, the dimple you have in your cheek or your chin, if you notice that a dimple suddenly appear on your breast, you need to take it seriously, because it could be a cancer that is invading the skin, so preventing that part of the skin from having the normal contour. So you have to pay attention to it. In fact, it's because of this dimpling that when you are doing a self-examination or you go to hospital for a breast examination, one of the first things you are asked to do is to raise your hand straight up. Yes. Because once you do that, if there is something holding the skin, it will become more obvious, and that could be the first sign that something is going on.
What about if there is a change in size? Maybe you notice that you wake up in the morning, you're like, my bust looks bigger than it did yesterday. What's going on? Could that be an indication?
If it's your bust in general, then it could be you're either putting on weight and you're now becoming more aware of it, or there's that time of the month that you generally have a bigger bust because of the hormone activity. Okay. But what most people would typically notice is that everybody has one breast either bigger or hangs lower than the other. Yeah. So if you notice that the one that hangs, the one that is smaller, suddenly is the same size as the one that is bigger, that's not too obvious to everybody else, but you can tell. If my left breast is supposed to be smaller, but suddenly it looks like it's the same size as my right, or it's now bigger than my right, then that's something that you should take note of. Okay. Or if my left breast is bigger than my right, but now it looks like it's much bigger than it's supposed to be, then again you should note that there's something going on. Okay. And so have it examined properly. All right. Very, very important.
Very good. Very good information. I mean, they tell us you should check once a month. You should examine your breasts when you're in the shower, preferably. Why should we do it when we're just out of the shower, in the shower? Why is that the best time to check your breasts?
I think it's convenient, because you're already out of your clothing. You probably have a mirror in front of you, so it's much easier to do an examination in that situation. Right. Because there's really no specific time you should do it. I mean, you should do it as often as you can. I mean, it's your breast, so you should know it. You should know it more than anybody else. Even your partner should not know your breast more than you. Because if there's a change, you will notice it first. But let me be quick to also add that the breast extends into the armpit. We call it the axilla. It extends into the armpit, and interestingly, that is where most cancer will develop from, because that is where most people ignore. So you have to pay attention to that part as well. If you do an examination, whether self or somebody does it, and the person doesn't check the armpit, it's not complete.
I see.
So you have to make sure that you also examine your armpit area to see what's going on over there.
Is there anything that can be done to prevent breast cancer?
So this is a tough question to answer. Okay. We don't actually know, apart from the people who have the genetic predisposition. Okay. They have the gene that we know would cause them to have cancer. We actually don't have any other cause of cancer per se. We know associations. Okay. And so because we don't know what causes it, it will be difficult to prevent it totally. You know, so that's why again it's important to keep screening, because so that you can pick it early enough for intervention to be done. And again, cancer diagnosis doesn't mean that they're going to cut off your breast, because that's one reason why some women run away from the hospital.
Wow.
You know, you know. So if we catch it early, we don't have to cut off the breast.
Okay.
You know, we can go in and deal with the cancer itself.
All
you
right.
know, so having said that, some of the associations, and I think I mentioned it in the beginning when I talked about the environment. You know, so people who avoid smoking,
drinking,
because smoking not only
excessively.
causes breast cancer, it causes so many other things: mouth, throat, stomach,
lung,
so many things.
Okay.
The lung is the obvious one, but it causes so much damage all over the place.
Very quickly before you go, Doc, treatment. So you've talked about, I mean, some people may have to get a mastectomy depending
Yes.
on the cancer. Any other treatment options that people have very quickly?
So there's radiation, there's chemotherapy, and there's also hormonal therapy, hormone replacement, and even now there's immunotherapy as well. So the treatment options are quite a lot, depending on what specific cancer you have and what stage of cancer you have.
All right.
Sometimes, or in fact most times, even after you've done a surgery, whether it was a mastectomy or was a lumpectomy or whatever it is that was done, you still need to take some chemotherapy or radiotherapy to try and target any spread that may have been missed.
Okay.
You know, because I mentioned that once you notice symptoms, probably it has already spread. So after the treatment for the main cancer, we give you subsequent treatment to target any other areas that might have been exposed, even though it might not have been picked up on the investigations.
Now, Pink October continues, so Doc will definitely be back next week, we hope, God willing, to give us more education on breast cancer, right? But they can contact you, right? Give us your handles, how people can get in touch.
I'm active on social media, Kelvin Owusu, MD.
Fantastic. Thank you.
Thank you,
Great
too.
to see you again, and thank you for the education. Dr. Kelvin Owusu giving us some important information about breast cancer. Check your breast if you're a woman, even if you're a guy. Check your breast, check your partner's breast. Get screened this month of October and check regularly. You can prevent it, hopefully, if you catch it early.